Can I ask the administrator to add Mayra Soto from El Salvador, please?
Yes, all the participants are being added now. It just take a few seconds.
Yes, but as I mentioned, I have another event that I also have to speak, so she will stay for the Q&A section.
Okay, great.
Thank you. Gracias.
Un gusto.
Carmen, did you already take the photograph?
Yes,
Okay, so we're set with that. We can start when you tell me.
we are good to go, Werner, whenever you want.
All right, so let's kick off then. Excellencies, colleagues and friends, it really is a pleasure to welcome you this afternoon to a very important event on healthy aging. Thank you very much for joining us. We are privileged today to be able to listen to the First Lady of Chile, Her Excellency Ms. Cecilia Morel, who has recorded a video message with which we start this meeting.
Domicilios a través del Ministerio de Salud y beneficios sociales para más de 8.500 personas mayores, incluyendo alimentación. Del total registrado, más de 1.200 personas recibieron apoyo psicológico con un promedio de 3 sesiones cada una. En cerca de 800 casos. En esta 11ª sesión del Grupo Abierto de Trabajo sobre Envejecimiento de la Organización de las Naciones Unidas, me gustaría saludar a todos los miembros de esta importante instancia y a quienes día a día trabajan por las personas mayores en todo el mundo. Durante todo el año 2020 y lo que llevamos desde 2021, hemos visto cómo las personas mayores han debido enfrentar una pandemia que trajo complicaciones más allá de la salud. Sé que este será uno de los temas centrales a discutir este año, por lo que me gustaría comentar brevemente nuestra experiencia en Chile, donde hemos priorizado la atención y cuidado de los mayores a la luz de la Convención Interamericana sobre la protección de los derechos humanos de las personas mayores. Los dos principales desafíos que hemos identificado para las personas mayores y sus entornos de apoyo son, primero, las dificultades en el acceso a la información, bienes y servicios. Y segundo, la necesidad de velar por la protección de sus derechos, propiciando la vinculación con sus seres queridos y evitando el maltrato en sus distintas formas. Chile estableció una estrategia de entrega de información a través de un número telefónico gratuito, Fono Mayor, que durante el año 2020 respondió más de 30.000 llamados, con un promedio de 150 consultas diarias, gestionando información y atención en salud para más de 4.500 personas. entregando medicamentos a domicilios a través del Ministerio de Salud y beneficios sociales para más de 8.500 personas mayores, incluyendo alimentación. Del total registrado, más de 1.200 personas recibieron apoyo psicológico con un promedio de 3 sesiones cada una. En cerca de 800 casos de maltrato se realizaron acciones judiciales y acompañamiento en este proceso. Este servicio se mantiene vigente durante 2021. Para velar por la integridad, seguridad y derechos humanos de las personas mayores, como gobierno entregamos elementos de protección personal a residentes y funcionarios de residencias de larga estadía. Se realizó una estrategia para trasladar a residencias seguras a personas mayores frente a brotes de contagio, lo que nos permitió salvar numerosas vidas. Además, se ha velado por las visitas seguras y reencuentros con las familias en este mismo contexto de institucionalización y para aquellas personas en cuidado de fin de vida, a las cuales se ha propiciado una muerte acompañada de sus familiares. A esto se suma la entrega de bonos para la mantención de personas mayores junto con cajas de alimentos en los momentos de confinamiento total. Todo lo anterior ha sido posible gracias a una alianza estratégica con el mundo privado, sociedades científicas, organizaciones no gubernamentales y la academia. Actualmente, Chile se encuentra en pleno proceso de vacunación. Comenzamos este proceso los últimos días del año 2020, poniendo a los adultos mayores como población prioritaria. Hacia la fecha, casi el 80% de las personas mayores, más de 2,7 millones, han sido vacunadas con la primera dosis y varias de ellas ya con la segunda dosis. Y esperamos que a fines de marzo toda la población mayor cuente con sus 2 dosis. Finalmente, considerando la enorme importancia que Chile le da a los adultos mayores, nuestro gobierno presentó al Parlamento una ley de envejecimiento positivo, destinada a instaurar una metodología de trabajo basada en la protección de sus derechos, alineada con los objetivos de la década del envejecimiento saludable de la Organización Mundial de la Salud. Espero que tengamos una sesión de trabajo muy eficiente y fructífera. Muchas gracias.
Let me, on behalf of everyone, thank the First Lady of Chile for those inspiring remarks and in particular for her personal involvement and leadership in the aging agenda. As you have all seen from the concept note, this event is going to focus on the decade for healthy aging and how it can be translated into national implementation and how member states and the UN system are jointly taking responsibility in promoting the implementation of the decade. As the First Lady has said, we are living longer, but we are not necessarily living healthier. And the pandemic has shed light on the implications for societies and for individuals. It goes beyond saying really that the response to population aging and COVID-19 goes beyond the health sector. It has to involve all kinds of aspects of societies, from the labor and financial markets, the demand for goods and services, education, housing, long-term care, societal protection and information. So the whole of society approach really is required. And that is why it was so encouraging and we are owing tremendous gratitude to the permanent missions of Chile and Japan for pioneering the effort through the General Assembly to proclaim a decade for healthy aging through the resolution that was adopted last December on the 14th. This decade has sent a very clear signal that it's only by working together within the UN system and with government, civil society, private sector, academia, and obviously including older people, that we will be able to improve their lives and the lives of their families and communities. Actions we take through the decade must be based on human rights. It has to address universality. It has to encourage the indivisibility of human rights to which everyone is entitled, without distinction of any kind. It must include the right to the enjoyment of the highest attainable standards of physical and mental health, adequate standards of living, education, freedom from exploitation, violence, and abuse, living in the community, and participating in all aspects of public, political, and cultural life. The decade creates a sense of urgency that is needed to meet the needs and rights of older people and drive transformational change. Let me mention, as we move forward into the discussion, that we are going to have two panels. This event is also being recorded and will be available on the UN Web TV for those who would like to watch it later or share it with contacts and friends elsewhere. The first panel will have some speakers from the UN system, and the second will focus more on national level implementation. And I encourage all of you to raise hands, which I already see a couple of, and also to use the chat function if you have questions, because when we conclude with the presentations, we should have a good 15 minutes or so for Q&A. The first speaker is the independent expert on the enjoyment of all human rights by older persons. It gives me great pleasure to introduce Claudia Mahler. Claudia, you have the floor.
Thank you, Mr. Chair. Mr. Chair, Excellencies, ladies and gentlemen, first of all, let me thank the organizers, in particular the government of Chile and the engagement of the First Lady for the kind invitation to join this important discussion. The Decade of Healthy Aging, led by the World Health Organization, is an opportunity to bring together governments, civil society, international agencies, academia, the media, the private sector, for 10 years to work together to try to improve the lives of older persons. As the independent expert on the enjoyment of all human rights by older persons, I advocate that any work related to the rights of older persons must be fully and firmly grounded on the respect of the human rights. The Sustainable Development Goals constitute an invaluable opportunity to increase the visibility of older persons and to highlight the inequalities in old age. While specific references to older persons are rare, they are far from perfect. It is welcome to note that for most indicators, implementation must be disaggregated by age, including to increase the availability of high quality, timely, and reliable data disaggregated by age. Whereas the Sustainable Development Goals have been a catalyst for improving general data collection around the world, countries still lag behind in producing data on older persons and lack systematic disaggregated analysis that is necessary for monitoring the implementation of the goals. I urge states to continue or to start to collect age disaggregated data in order to bring about policies which can benefit people based on their age, in particular older persons. The Decade of Healthy Aging was launched to further the realization of the SDGs. Therefore, I'm pleased that one of the 4 areas of work of the Decade of Healthy Aging is to combat ageism in the pursuit of creating an age-friendly society. In parallel with the Decade of Healthy Aging, I wish to commend the launch of the first ever global report of WHO on ageism, which is a great starting point for raising awareness and collaboration to combat ageism. Besides examining the human rights situation of older women in 2021, I will also be dedicating a thematic report to ageism and age discrimination, while its focus will be on older persons. I hope it will bring to light overall intergenerational benefits. COVID-19 made apparent the urgent need to identify ageist attitudes, which lead to age discrimination. Unfortunately, while the prohibition of discrimination based on age is implied in international human rights law, there is no specific prohibition targeting explicitly based on age. This results in lacuna in protection of human rights based on age, which the pandemic brought sharply to light in 2020. in order to tackle the other areas of the decade, including the personal-centered integrated care and primary health services responsive to older persons, and to provide long-term care for older persons who need it, we need to ensure that they are not discriminated against based on their age. The highest attainable standard on health is part of the Covenant on Economic, Social and Cultural Rights and is enshrined in other human rights treaties. But the current crisis showed quite clearly that older persons did not get the treatments they needed, and their healthcare was neither accessible nor available to them, in part because of their lack of inclusion in national emergency plans. The update of the analytical OHCHR study points to the absence of provisions in the current human rights system, including in the areas of long-term and palliative care. With regard to long-term care, the will and preferences of older persons on the types of treatment they wish to receive need to be taken into account. A key area for achieving a principled approach to a human rights-based approach is to ensure the participation of older persons in the decision-making processes in healthcare and support, palliative care, and long-term care. My first report to the General Assembly, dedicated to the impact of COVID-19 on the enjoyment of all human rights of older persons, showed how they were discriminated against based on their age. They were not consulted in issues which directly impacted them, and they were denied services, both at home and in long-term care facilities. Governants are duty bearers and older persons are rights holders for their entire lives, and conditions should be provided for them to be able to decide with respect to their preferred living conditions, as well as in conditions related to their primary health care and support, palliative care and long-term care. Creating age-friendly environments should include the possibility to live, study and work, receive healthcare and support with being discriminated against on their age, and this will eventually lead to an inclusive and age-friendly society. To achieve this, we need to take into account that older persons should be able to learn at all stages of life and study in universities, not just those designed specifically for older persons, and that they are provided with the conditions to live and enjoy life throughout their entire life cycle. I thank you once again for inviting me to join this important side event, and I look forward to continue and to get engaged in this important topic. I see the decade as a wonderful awareness-raising tool to highlight the urgent need to strengthen the human rights for older persons. Thank you.
Thank you very much, Claudia, for agreeing to participate in this event and for all the important work that you do for the aging population. It was really very interesting to hear your perspective. And now it gives me a great pleasure to introduce a good friend, Alana Officer, who is the Senior Health Advisor for Aging and Life course in WHO, in the World Health Organization. She really is the person representing all the work that we do in WHO on aging. So if ever there was a person eminently qualified to talk about the topic, it's her. Alana?
Very kind word. Thank you for the kind introduction. And good afternoon and good evening, everybody. And a huge thanks to Chile for this event and for your continued leadership around the decade. So I am going to, in the next 10 minutes, give you a very quick overview of the decade of healthy aging, identify some of the linkages, building maybe on what Claudia has just said, between the decade and the human rights, or the efforts around advancing human rights within the UN, and then look at how we can implement and measure success. So I just want to check you can see the screen. It's visible, a full screen for everybody. Lovely. If I speak too quickly, just raise your hand and I will do my best to slow down. So, as you've already heard, actually I'll just go back and just that reminder that in terms of the decade, we have a really important joint responsibility to improve the lives of older persons, their families, and their communities. And the decade of healthy aging, as we know, mandated by WHO, but declared by the UNGA, and strongly connected to other agendas, the SDGs, MIPA, and other work being carried out within WHO. So, as you've also heard, it's really intended as a global collaboration that brings together really diverse sectors and stakeholders from governments and public and private sector, academia and the media. And already, as part of the process, there were 86 governments that provided substantive inputs to the decade under the leadership of Japan and Chile in that coordination. 300 civil society, 19 international organizations, and 77 member states co-sponsored the resolution in the UN. So already a lot of engagement that we can build on. We've also seen an incredible amount of support from global leaders in terms of the UN Secretary General, Dr. Tedros, but also other heads of agencies. But going beyond that, representatives of the private sector, civil society, and academia, just recognizing and conferring with what Claudia said, the importance of the opportunity that the decade provides. So now I just want to look at what are the connections between the decade and the work around human rights, which is integral. But for those of you who recall in the UN resolution, it was explicitly said in regard to COVID that we needed to work to respect the dignity and promote the human rights of older persons, including the right to the enjoyment of the highest attainable standard of physical and mental health. But the resolution also recognized the challenges, and we've heard a lot about those in terms of the OHCHR gap report around the enjoyment of human rights that older persons face. And the resolution calls for states to promote and ensure the full realization of all human rights and fundamental freedoms of older persons. So we have a responsibility in terms of the work of the decade, which really focuses on 4 action areas to make sure that they are delivered in a human rights-based approach. So those 4 action areas are changing how we think, feel, and act towards aging or combating ageism. And there you can see the cover of the latest UN global report on ageism, which we were happy to produce with OHCHR, DESER, and UNFPA. Working to ensure that communities really foster the abilities of older people so that they can continue to sort of be and do what they have reason to value. Delivering integrated care and primary health services that are actually responsive to the needs of people as they age, and providing access to long-term care for those who actually need it. And you will note in those action areas that there are multiple intersecting human rights and freedoms. We've heard about the highest attainable standard of health, but also an adequate standard of living in the community. The right to live in your community, to have access to lifelong learning, to a decent job, to have, as we heard also from the First Lady, freedom from violence and abuse, participation in public, political, and cultural life, and in some contexts, just the basic right to even own or inherit property. So a number of areas for which the decade and rights which are directly relevant to the work that will be carried out. So I want to look now just at how do we achieve and measure success on the decade. So there was 4 action areas. You can see those on the left-hand side of your slide, but those action areas are actually supported by what we call 4 enablers. And these are also really relevant in terms of the human rights of older persons. So listening to the diverse voices and enabling meaningful engagement and participation, nurturing leadership and capacity, connecting the different stakeholders, whether it be in terms of clinicians together or policymakers together, but also across sectors, and strengthening, and we've heard about this from Claudia as well, in terms of data research and innovation. So to do that, we've built in collaboration with other stakeholders a platform which is intended as a one-stop shop for knowledge on aging, an opportunity not only to find the knowledge that you need to deliver on those action areas, but also to be able to share the knowledge that you produce. And this is really an important opportunity, an open, collaborative space for sharing and exchanging and co-producing knowledge that can help us all actually deliver on the sort of transformative change that has to happen in terms of older persons. So it's really that space to connect through the platform, policymakers, health providers, academia, older persons, and the private sector as well. So in terms of the decade, we need to show that we've actually made a difference. So the plan outlines a framework for tracking progress that draws on existing indicators that we have related to the WHO Global Strategy and Action Plan, but also the SDG indicators if we can have them disaggregated. But we also need to align so as to reduce burden, the way that we monitor and evaluate, for example, by linking with MIPA and the voluntary national reviews on the SDGs. But we also have to go beyond the numbers, yeah? We have to, these do not give us a lot of information or any about the lived experience of older persons. And we need to also recognize the importance of citizens' voice as those rights holders' voices in the way that we understand whether we actually are achieving success. So last year, we produced a baseline report for the decade. And on this slide, which is a little difficult to say, you can see some of those indicators, and you will see that over the last 2 years, there has been progress, which is fabulous. And that if we continue in that track, some of those progress indicators will be met by 2030. Others will not. And there we really need, for example, on age-based discrimination, we really need to be much more proactive if we're going to achieve any really substantive change. We have, in addition, provided, and we hope that this will be useful to countries, a new hub of data which links to the platform, which provides data across all of the action areas and which is disaggregated by age and other socioeconomic characteristics. And we hope very soon that we will have individual country profiles. If you're interested in having those indicators related to your country, that they will soon be available, which can help inform your own decisions around where you may wish to prioritize action around the decade. So in terms of the baseline report, I just wanted to highlight, it really stresses the importance to invest in data and monitoring healthy aging, the need that we need to accelerate action if we're going to make any real measurable impact on older persons, that older persons need to be, as rights holders, engaged in all decisions that concern them, and that there is a range of other information in there. So we're 90 days into the decade. We have already started to build quite a really strong foundation. Clearly, we have a lot to do in terms of improving the lives of older people, their families, and their communities. But I look forward to working with you to do that. Thank you very much.
Thank you very much, Alana. This really is very impressive to see how much work has already been done just a few months into the decade. Of course, as WHO sometimes is able to do, we were planning in advance. So since the World Health Assembly actually requested this decade to be proclaimed last May, we had some time to do our homework, build a coalition among the UN colleagues, champion countries, of which Chile and Japan are standouts. And so it's a pleasure for me now to turn more to a UN perspective and introduce Masumi Ono, who is the chief of the Social Inclusion and Participation branch in the UN Department for Economic and Social Affairs. And they are, of course, a long-standing partner in the aging agenda of WHO and member states, particularly also through the open-ended working group, which is meeting this week. Masumi?
Thank you. Good afternoon, Excellencies, colleagues. I will focus on two aspects, and thank you firstly to Chile and Japan for your leadership, and to WHO for the great collaboration that we enjoy. The two aspects I'll be speaking on is the current collaboration within the UN system on the implementation of the UN Decade for Healthy Aging, and the link of the decade to the work of the Open-Ended Working Group. As Alana already mentioned, the decade is aligned with three priority directions of the Madrid International Plan of Action on Aging, and it reflects the pledge in the 2030 Agenda on Sustainable Development to leave no one behind. If we want to meet the SDG targets, we must raise visibility of older persons and address their specific needs and challenges. The decade can also help address the gaps revealed by the pandemic. The decade is a global, multi-sectoral and multi-stakeholder undertaking and has actively involved and engaged DESA and the UN system since its inception. This global collaboration has the potential to build on existing synergies, align with the UN reform, contribute to the progressive realization of the rights of all older people everywhere, and the enjoyment of the highest attainable standard of health. And it can harness the social and economic opportunities that population aging provides. To enhance collaboration on the decade, DESA has led the facilitation of the Interagency Group on Aging, which is an informal network of UN entities. Within the umbrella of the Interagency Group, WHO organized a meeting on UN partnership for the decade in January of this year, and initiated a joint UN planning process for its implementation. In this meeting, participants from the UN system identified several key entry points and opportunities. Discussions touched upon how to empower UN country teams and regional collaborative platforms to advocate for the decade at the country and regional levels, as well as the need to leverage the decade to advance healthy aging in country plans and programs. It explored the data dimension, looked at ways to foster partnerships at country and regional levels with older persons, and addressed accountability. The Interagency Group plans to meet again next week on the UN partnership for the decade to share updates and identify next steps. On the General Assembly's Open-Ended Working Group, which is meeting this week, the decade can complement its work. As we know, health in old age is related to inequality or disadvantages accumulated across the life course due to socioeconomic status, gender, or location. The Open-Ended Working Group has engaged in substantive discussions on equality and non-discrimination, violence, neglect, and abuse, autonomy and independence, long-term care and palliative care, and many other areas of relevance in the implementation of the decade. Additionally, the right to health is an issue that remains to be discussed in the working group, and we hope such discussions will be done in synergy with the implementation of the decade. We sincerely look forward to continuing our collaboration. Thank you.
Thank you very much, Masumi, for also informing us how the UN system is coming together around this agenda. There is a lot of work to be done in the 10 years leading ahead. And nowhere more important is this work to be done than at the country level. And so it gives me great pleasure now to move to the second part of our discussion, to hear from those experiences and introduce Pablo Gallardo, who is the director of the Geriatric Institute of Chile. And he's joining us from Santiago, if I'm not mistaken. Pablo?
Thank you very much. Good afternoon. Valued members of United Nations Working Group for the Senior Citizen Health Aging Process. As a director of the National Geriatric Institute of Chile, it's my honor to share with you the implementation actions of our institution to better the life of our older persons their families, and the community. We would like to tell you that our institute exclusively attends people age 60 and over, who are at high risk of functional loss, known as frail patients, in the hospital care area, with home care levels, as well as outpatient specialty care achieve the functional recovery of the person who loses it due to medical complication or functional decline. As you know, this care is possible thanks to interdisciplinary teamwork that achieve the desired results. One of the great challenges of the decade of aging is to keep the elderly self-sufficient until their last day of the life. To do so, we must integrate medical, functional, psychological, and social aspects to achieve the best action plans tailored to each patient. This plan must be sustainable over time, so geriatric care models must be quantified and ensure their cost effectiveness. In this regard, the National Institute of Geriatrics is working together with relevant stakeholders, such as universities, civil society, Older People National Service, SENAMA, and the Chilean Ministry of Health, on a new National Institute of Geriatrics that is currently under construction and will be operational in 2023, which will have a new research, teaching, and innovation department that will be enhanced by a new data collection platform. This will allow us to link new care to older persons, efficient in the manner of use of resources, application, and new technologies developed by university and applied in the institution and the special place for telemedicine. Since the pandemic has taught us that the lack of specialist care for older adults due to geographical limitations on travel places them in the disadvantaged position and undoubtedly more vulnerable. Presently, this survey taking place about telemedicine users' effectiveness. In Chile, difference in access to a specialist is relative, depending on the area of the country where we are. So we are able to bring technologies closer to could become to a solution not only in Chile, but for the whole the Latin American regions, characterizing the cultural difference of each area. Finally, we thank you for the invitation, and we are very hopeful to tell you the results in this experience in the next years to come. Thank you very much.
Thank you very much, Pablo, for joining us. I think you really touched on some very important issues there on how to bring services closer to people who are in need, the value of telemedicine, particularly in the current situation that we live in. This is something that has actually taught us many valuable lessons we can apply for many years to come as well. And the most important thing I think we often overlook, and it is a question of data. You know, if we cannot measure, then you cannot implement, and you don't know where you are making an effective intervention and where you are not. It is now my pleasure to turn to another long-standing champion of human rights, of disabilities and mental health, as well as the aging agenda here in New York in the General Assembly. And it is a privilege to introduce Ambassador Griselda Lopez, who is the permanent representative of El Salvador.
Thank you. Thank you so much for the warm welcome. And at the outset, let me express my sincere gratitude to the permanent missions of Chile and Japan, UNDESA and WHO for organizing this timely event, for which my country is a proud co-sponsor. Excellencies and colleagues, let me begin by recalling Article 1 of the Universal Declaration of Human Rights, which establishes that all human beings are born free and equal in dignity and rights, and also the principle of universality of human rights as a cornerstone of the international human rights law. It is important we remember these two provisions. First, because we observe that there is a stereotypical and negative vision of aging, which subordinates those who experience it. Second, because we see that chronological age is what determines, in many cases, the dependence and independence of people. For example, for children, dependency is marked by the lack of ability to decide independently as a protection measure so that they can effectively develop their capacities for the next years of their lives. And in the case of older people, this dependence is marked by the loss of their autonomy or the limitation to exercise it. Third, because the scope of universality does not cover older persons. And an example of this is when we speak of universal health coverage, when we speak of universal social protection, when we speak of guaranteeing inclusive, equitable, and quality education, and to promote lifelong learning opportunities. And fourth, because to move towards inclusive and democratic societies, we must accept the differences and demographic trends already known between and within our countries, ensuring that these differences are part of human wealth and do not become a reason for segregation. Additionally, the COVID-19 pandemic is having a devastating impact across the world, with a disproportionate risk for mortality and severe disease following infection, but also poverty, discrimination, and isolation to older persons. According to the Secretary General Policy Brief on the impact of the COVID-19 on older persons, with lockdowns and reduced care, violence and discrimination against older persons is on the rise, especially older women depending on family members for their daily survival, making them even more vulnerable to this type of abuse. It is also important to mention that the SDG 3 aims at ensuring healthy lives and promoting well-being for all ages. That is why this decade of healthy aging, 2021-2030, represents an opportunity to achieve the Agenda 2030 by focusing on evidence-based actions while strengthening the focus on equity and leaving no older person behind. The 4 areas of action, namely age-friendly environments, combating ageism, integrating care, and long-term care, represent a platform where many sectors will have to be involved to improve healthy aging, including health, finance, social protection, education, labor, housing, transport, information, and communications. For this, it is crucial to involve national, subnational, and local governments, and also service providers, civil society, the private sector, organizations for older persons, academia and older people, but also their family and friends, to shift not only in the actions we take, but in how we think about age and aging. I must say that El Salvador co-sponsored the resolution of the United Nations Decade of Healthy Aging, adopted by consensus in December 2020. And we will do all efforts to make it a reality and to promote it here in the United Nations. Excellencies and colleagues, as a country, we're also proud to say that our region is a pioneer in creating a legally binding instrument, such as the Inter-American Convention on the Protection of Human Rights of Older Persons. This is an instrument that brings into line guarantees that no other binding international instrument had previously explicitly considered in the case for older persons, such as the conjunction between the right of life and dignity in old age, or the right to independence and autonomy. Let me highlight that this convention includes in its Article 9 the right to health and establishes, among other measures, the importance of formulating, implementing, strengthening, and evaluating public policies, plans, and strategies to promote active and healthy aging. In that sense, since January of this year, my country has a new special law for the protection of the rights of older persons, which responds to the commitment assumed by El Salvador in this Inter-American Convention. We're also developing an action plan 2021-2024 to strengthen our actions in favor of older persons in our country. To conclude, I would like to mention that El Salvador, together with a group of countries, organized a joint intervention within the framework of the United Nations in support of the policy summary presented by the United Nations Secretary General on the impact of COVID-19 on older persons, which had the support of 146 members and observer states, that is, the majority of the UN membership. We firmly believe that old age can't and should never be an excuse to restrict or limit autonomy, or to trample or to undermine the dignity of older persons. Therefore, we believe that we must work all together to strengthen international and intergenerational solidarity in order to encourage responses that promote the human rights and dignity of older persons, also considering them as key allies in the framework of multilateralism. The Decade of Healthy Aging represents an opportunity to achieve this purpose, to bring the conception of healthy aging to the attention of all member states, to move forward in strengthening the current international framework on the rights of older persons. We need more political will to move forward with concrete actions at the United Nations. Therefore, we appreciate the commitment of civil society and all relevant stakeholders and partners. Let's continue working together to combat ageism, age discrimination, to promote the rights of older women, and also the notion that older persons are agents of change. I thank you. Gracias.
Thank you very much, Ambassador. You really put it in a brilliant closing remark that older persons are agents of change. That is really, really important. I think you also mentioned lifelong learning. We are, of course, all students that need to learn more in that context. And I was struck by what you mentioned about the political leadership that is required. This is, of course, something which we are very grateful to you and your country for, in terms of the joint statement of support, which was formulated after the SG's policy brief, which we in WHO worked very hard towards supporting his office with. So thank you so much for sharing your experience from the country level. A lot of lessons I think many of us can learn from what you are doing. And before I turn to the final speaker in our lineup today, let me ask you participants if you could please use the chat function to indicate questions you may have of the panelists or comments that you may wish to make. If none of you make use of that facility, you're going to make me feel much older very quickly, because it will force me to speak for the next 10 minutes, and I'm sure you don't want to listen to me. The final speaker which we have today is another good friend of mine, and many of you know, and he is the minister at the Permanent Mission of Japan to the UN, Junya Nakano, who was also the co-facilitator in the General Assembly process, which culminated in the adoption of the Decade for Action. Junya?
Thank you very much, and thank you, Wana, and thank you for giving me to have this opportunity to share Japan's experience with you today. And I would like to make a short presentation focusing on the current situation in Japan, which we are facing with rapidly aging population and its impact on economy and social aspects. And secondly, I would like to share with you how our government and the stakeholders are coping with this issue. So firstly, Yosuke will help me. He's helping me to provide some slide. The first slide, please. I think Japan is a very famous country in experiencing a globally unprecedented aging of its population, as you see in the slide. Currently, the population or a proportion of the persons aged 65 years and over is about 30% of the total population. With more than a quarter of its population over 65, Japan has largest proportion of older people in the world. This proportion is expected to rise to 1/3 within 2 years and about 40% by 2060. Furthermore, the speed at which Japan's population is aging has been very rapid, being 2 to 4 times faster than that of European countries. Japan's aging population also has a remarkable depth to it. And by depth, I mean that even within our older population, there is a rapidly increasing number of extremely old aged persons. For example, if you look at this slide, in 2016, the proportion of the age, the people who are aged over 75 is about 13.3% in 2016. And the proportion of aged between 65 to 74 is about the same number in 2016. But if you look at in 2065, the proportion of aged over 75 will occupy 25.5%, whereas the aged between 65 to 74% will be 12.9%. So it is almost double number for the people over 75 years old. So this means that we will have a very top-heavy age structure in the future. Accordingly, the labor force in Japan is also projected to decline from 67 million people today to less than 55 million in 2040. This sharp decline in the workforce will have serious negative impacts on the economy. Firstly, a shrinking workforce will bring about decline in total production, unless productivity per worker increases substantially. And secondly, a shrinking workforce will bring about a decline in consumption, unless the wages per worker and the consumption will increase dramatically. And on the one hand, an aging population will increase demand for social security benefits, including retirement pensions, medical care, and long-term care. On the other hand, it will strain the sustainability of our national social security system. So secondly, how to cope with this rapid aging situation? In order to cope with such drastic population aging and its potential negative outcomes on our socio-economic structure, we have to take every possible measures to adapt. We have started by establishing what we call the lifelong active society, which aims to maintain the highest levels of independence and inclusion of older persons with society. In addition, we have begun to reform our national social security system, particularly with regards to medical care and long-term care. Of course, the fact that we are facing such tremendous population aging is itself a result of the success of our social security system, particularly our medical care and long-term care systems. Japan has already achieved universal health coverage as of 1961, and we established our long-term care system 20 years ago. As you may be aware, Japan has been actively advocating the promotion of universal health coverage in international fora as well. Basic health services under UHC include primary health care, maternal and child health, infectious disease control, comprehensive community care for the elderly, and nursing care. So next slide, please. With regards to medical care and long-term care, we will certainly see an ever-increasing need for such care in the coming years. As the number of older people who need medical and long-term care coming into hospitals increases, the beds in hospitals will overflow sooner or later. In order to address this issue, in 2013, the National Council on Social Security System Reform in Japan recommended to establish a community-based comprehensive care system in local communities all around Japan as soon as possible, where all the people who need medical care and long-term care can be taken care of, as you see in the slide. At that time, our slogan was from hospitals to communities. We are now working tirelessly to set up this system by year 2025, which is when we expect a substantial jump in number of older people who will need medical and long-term care. Next slide, please. Secondly, it is also very important to support healthy and active aging among our elder population. Among our efforts to achieve healthy aging, prevention and the realization of science-based long-term care using data should be referred. And the photo is this one example of the efforts conducted by local city, which is in Aichi Prefecture, near to my hometown in Japan. And this is sort of activities conducted by local communities and local government and stakeholders. The most recent figures shows that the number of people eligible for long-term care insurance benefits in Japan has reached 6.6 million. However, prevention can be more effective than treatment for the elderly if appropriate interventions are in place. Receiving appropriate care on a daily basis can reduce the likelihood of ill elderly people. The government is also aiming to realize science-based long-term care by utilizing the assessment data that is regularly collected from people using long-term care with the aim of supporting independence and preventing severe disease. For example, a full-fledged long-term care database will be established and utilized starting from this year to collect and analyze the necessary data to evaluate what kind of supports, interventions, and care for the elderly will lead to independence and to realize long-term care that is scientifically proven to be effective in supporting independence. So finally, I would like to mention you that this issue may not apply to your country at present. And you may think that this is a quite unique case to Japan. But sooner or later, you'll be faced with this aging population in the future at some point. I believe that the experience of Japan today will have very useful implications and input for you to make adequate policies to prepare for aging population in the future. Thank you very much for your attention.
Thank you very much, Junya, for sharing the experiences of Japan. I think you made a very convincing argument about universal health coverage and how this really benefits all population groups and calls for the inclusion of older persons, particularly in the demographics that you showed there. How many more hospital beds will be required in the years to come? This is certainly something that most countries in the world will be facing. As a matter of fact, I was just looking earlier today about some of the projections that a number of investment banks have come up with. Barclays, the well-known British bank, actually have come up with a really fascinating piece of work in which they stress the fact that there are more people today aged 65 and older in the world than there are under the age of 5. And the oldest group, those 85 and older, they are the fastest growing segment of the population. And all countries in the world really face this kind of exponential growth in older people, as Japan, for example, have pointed out. So it is something that is extremely topical for us to be talking about today and in the next decade ahead. I have not seen too many questions in the chat, although I have seen many people post resources there. But I've also snuck a little peek at the participants list, and I see several names there of people that I know. So if nobody is going to volunteer to ask a question or make a comment, I'm going to ask a good friend of mine, Erika Dar of the AARP, if she would like to contribute to the conversation, because AARP has also done some very good work on the economic influence of older persons, not only here in this country, but globally. Erika, you're on the spot.
Yes, you are putting me on the spot. Thank you very much, Werner. I see a lot of familiar faces. Ambassador Griselda, lovely to see you again. I will not take up too much of your time, but since you reference AARP, we just launched our report on the longevity economy yesterday with The Economist. I would suggest for our resources on the work we're doing around World Economic Forum, the Living, Learning, Earning Longer project for the private sector. We have over 50 multinationals now signed up to put into their policies issues, and we have about 10 criteria that they have agreed to for retaining, retraining older workers. So AARP is being very proactive with the private sector on the issue of older workers. Around caregiving, we have also at the national level worked with the U.S. government at the different states, with different states, to offer caregiving credit for family caregivers. We have brought out a report on the economic value to the GDP of family caregivers. We have also brought out a report that 1 in 4 millennials is a caregiver. So now we are taking on the issue of racial justice and inequality. Many of you around the world may have noticed that we have had some really tragic events in the United States with Black Lives Matter, and COVID has exacerbated in minority communities the disparities with communities of color. We are taking this on, especially because of older persons in these marginalized communities. That being said, as we are all digital right now, AARP, we are working very closely with the Secretary General's high level, he's brought together a special envoy on tech. The tech position is now in transition, but he's pulled together the roadmap on digital inclusion. And AARP earlier this year, Claudia Mahler was a speaker for us. The government of Mexico was represented. We talked about digital inclusion and older persons, a smart mix. We are really pushing this issue of disparities and planning for the future now with the private sector on access, on universal design, equity, because we are looking to the workforce of the future. But by the way, also not just older persons, where AARP talks about the multi-generational workforce of the 5-generation workforce. So I will be quiet now, but I will, if anybody wants to reach out to me for the resources of the work that we're doing in all these areas, and with WHO, we, of course, AARP, we have, and Alana can speak to that. Alana, am I right in saying we have the largest network of not only age-friendly cities in the United States, but also down to the community level, right? Alana, feel free to hop in.
You may soon be taken over by Chile, but yes, keep competing.
Yes, we will work with Chile. So that's it on our end, but I'm happy to follow up with anybody that would like to know more about our work. Thank you, Werner, for the opportunity.
Thank you, Erika. Now everybody knows that I had lined this up long in advance because I knew you had something prepared. Just ready up your sleeve.
That is really not true, but thank you.
I don't see any other requests for the floor, and I'm sure not all of you will be so gracious as Erika has been, if I name and shame some other people. So let me go back to those who are participating in this event as speakers and ask if they have something else that they would like to add. Claudia, would you care to reflect on what you have heard some of the other panelists say?
Thank you for giving me the floor again. I think for the work I'm doing, it is essential to have connection to the national level. And there were many fields already raised in the different statements. And I think it's wonderful if we manage to have some meaningful conversation with the mandate and with others together. And maybe we manage to get better engaged and better support each other to collaborate for our common goals. I just wanted to say this, and I think this is really a fruitful approach if we collaborate more. Thank you.
Thank you. Alana, would you like to add also some reflections? There was an interesting question I see in the chat. Maybe you can address that as well, about the lack of sufficient pensions in low and middle income countries, and that older people really struggle, particularly now during the pandemic, also to pay for services that they need out-of-pocket expenses for.
Thanks, Werner. I mean, I think that this is a really a challenging area that was a challenging area pre-COVID, and then COVID's really highlighted in the area of social protection, but in many other areas. Pre-pandemic health has had a huge influence on post-pandemic health. You know, access to technologies and digital accessibility before the pandemic has had a huge implication as to whether people get access to appropriate information, can book and access their vaccine. So, you know, I think the pandemic has highlighted huge gaps in the enjoyment of a range of human rights. I think if I wanted to make one point, if I may, is really on the importance of if I just hit on the changing how we think, feel, and act towards age and aging as an important foundation for all of the work that we do. And I saw a comment about, you know, how can we celebrate the enormous contributions that older persons make to society? And so often we think about aging as a challenge, you know, as a problem, and that needs to shift. And I would encourage people to read the Global Report on Ageism, which, you know, affects people of all ages, but the really harmful impacts of ageism are experienced in older life, and they are devastating. And I think that there's a silver lining to that report, and it's that we know what works. And it, you know, education, intergenerational contact, and policies and law. So we need to be investing in those, as we've seen from the example of El Salvador and other countries. These are really important in terms of changing opportunities as we all grow older. Thank you, Werner.
Thank you, Alana. Masumi, some final thoughts from your end?
Thank you. Maybe just two things. One is that this decade, it's great how it's situated and connected and aligned to the broader picture of what is going on, and that really helps us sort of make the push, especially at the country level. And secondly, this life course approach concept has come up in various forums and meetings, and in my branch we also cover the youth, so we will certainly, you know, working with all our partners, work towards this sort of intergenerational conversation and using that to help change the perception, the way we feel and act, and so on. Thank you.
Ambassador Griselda, would you have some final thoughts from your side? I saw you nodding when Erica was speaking, so clearly we all agree.
Thank you, and regards to you, Erica. Nice to hear you. And just a few reflections about the topic that we have been discussing in this Q&A section about intergenerational solidarity and how important it is to link and to make efforts between youth and also older persons. And thank you, Masumi, for bringing that idea of link them efforts in these two important social groups. And I guess that is not a matter of competition about who is more important in the US, if the youth rights or the older person's rights. And I can tell you that I was in another event about precisely the group of friends of youth. So I am personally convening the message of the importance of the two groups, older persons and youth, not to see them about, and as I mentioned, a competition, but to bring them all together. And the intergenerational solidarity concept, it's a strategy to do so. So you have that in mind. We can work together also with the leadership of Chile as chair of the group of friends of older persons. And again, the commitment of El Salvador for change the narrative in the United Nations about older persons. Not that they are only recipients of aid, but as I mentioned at the end of my intervention, agents of change. Thank you, Bernard.
Thank you very much. Pablo, ¿algo más? Is Pablo still online? If not, Junya, would you care to have some final reflections before we wrap up?
Thank you. I just want to mention that we are ready to provide the Japan's experiences as you wish, and anytime contact me or our expert Yosuke, who is coming from the Ministry of Health. I will help you if necessary. Thank you, Werner.
Thank you very much. I want to now ask the permanent representative of Chile, Ambassador Milenko Skoknic, who is really a very long-standing champion of aging, and of course also leads the group of friends in New York, to make some closing remarks for us and a vote of thanks for everyone who participated. Ambassador?
Thank you. Thank you very much, Bernard. And I think closing remarks has been done already through these comments that everyone had the opportunity to share at the end. So I would concentrate on thanking, expressing our gratitude on behalf of the government of Chile, of the cabinet of the First Lady, and all other institutions in Santiago that have collaborated. Thank you particularly to our wonderful panelists of today, the independent expert, Claudia Mahler, of course, and Alana from the World Health Organization, and Pablo as well from I'm sorry, Masumo Ono from the DESA, from United Nations Department of Economic and Social Affairs. So it has been wonderful first panel that we could see the perspective of the institution. And particularly, I have to say thank you very much to you, Werner, for conducting this. I know the World Health Organization is doing a lot of things these days all over the world, but still you are part of the duty regarding older persons are still here. And I think it's very valuable that you take the time and helping in organizing this. And then we have the perspective of the country. So once again, to my wonderful colleague Griselda, who used to be the chair of this group of friends of older persons that we are doing now. And of course, we have to chair as well many other activities. So thank you very much for your activities. And to our colleague Yunya from Japan, always an example, always something to interesting to follow you. And I see many people here, many friends from civil society. Maybe they didn't ask the questions, but I know that they are very active, and I know that they participate very strongly on all the other activities that we do. And a closing gratitude to our colleague Carmen Nishihara for organizing and being in contact with many of you, so we could do this on time. And I think it was very interactive for all these reasons that I already explained. Thank you very much, Werner, once again.
Thank you, Ambassador Milenko. I should also thank my colleague, Eva Kiegeler, who was very instrumental in making this event possible, for her invaluable support. And thank you to all the participants who have stayed with us all the way through to the end, even a few minutes after. You have certainly made me feel much younger, and I have a lot of energy for the rest of the afternoon. I hope all of you have a wonderful afternoon and evening ahead. And those of you who are far away, have a pleasant night. Thank you.
Thank you.
Thank you.
Thanks,
Thank
everyone.
you, Anna. Thank you, Ambassador. Thank you. Thank you, Carmen.